Hi, I'm Virginia from Right Clinic, and here with me today is Farheen. Thank you so much for being here today. Would you like to introduce yourself?
Hi, Virginia. Thank you for having me on your podcast. I'm super excited. And I'm a freelance medical writer. I live in Dubai. I am from India. And I have been freelancing in Dubai for the last 8 years approximately. And I'm so happy to be here.
That's amazing. I'm so excited to hear your story because it's really different. So, how did you get into medical writing?
Well, it's very interesting for me because when I was in college, I did not know that a field like medical writing exists in the first place. So after my master's, I happened to join a company via campus placement for their pharmacovigilance team, where we wrote drug safety reports. And I was apparently their guinea pig. They said, we want to experiment how freshers do in this department, and we're going to start with you. And I was super excited. And I said, yes, why not? I am open to it. I love communicating. I love talking. I love presenting. I love writing. But I did not know how to put it to use as a profession. So when I started writing drug safety reports, it got me, really interested. And I started reading a lot of journals. I did a lot of literature reviews, and I got into the field of medical writing that way. But still, I did not know that this is medical writing because the positions were different. There was no such separate department at that given point of time. And when I moved to Dubai around 10 years ago, medical writing was like unknown to everybody. There were hardly a few people who were a part of agency, but it was just one writer who did everything. There was no there was no stratification, there was no categorization as to who's going to do the regulatory or who's going to do the medcom publications or something else. It was like one person does it all. And usually here it was a big challenge for me to begin working because of the language barrier. Arabic and English both are not my native languages. So usually the companies preferred either one to be, your native language. It has to be either English or Arabic. And I had none. So I decided to go freelance, and I kept on networking. I kept on cold emailing to people on LinkedIn, and it paid off. I finally got my first request for covering an advisory board report. I did not know what an advisory board meeting is at that point of time. I researched into it. I read, I got the topic done. And then after that, there's no looking back. So far, I have participated in over 100 advisory boards, and I've crafted high quality reports. And through my network, I have even created different scientific documents, posters, e-detailers. I have helped students with their thesis and publications and poster presentations. And I have written like so many manuscripts, and it's been on and a wonderful journey so far. I'm loving it.
Amazing. You've done such a variety of things, which is super interesting. So,
Yes.
how do you kind of find your clients now? Because are you working totally freelance? Are you working from home remotely? What's your kind of lifestyle like, and how do you find your clients?
So when I started working freelance remotely, it was in 2018, and that time remote work was not that, in. It all happened after COVID and the pandemic era. But until then, people were like, "Where's your office?" And I'm like, "It's at home or a cafe or wherever I want it to be. I just need my laptop. That's it." But now, as far as the clients are concerned, thankfully, by God's grace, I have a lot of retainer clients who have been working with me since 6, 7 years. I do get a lot of new clients through LinkedIn. I also get a new clients through the networks. I attend so many meetings, so in-person contacts, and I think that helps a lot. The companies approach me directly. So yes, it's a full-time freelancing job.
I really like that. And I like that you are constantly networking as well, because I think
Yes.
sometimes you can really depend on your retainer clients, but then if one of those disappears one day,
Exactly.
yeah, you need a
Uh,
replacement.
you need some backup. You need, like, okay, I'm gonna do, I mean, you can't just sit idle. And amongst this, I think the most interesting was I even got to work on certain regulatory documents. That was a very different experience for me. And I'm really looking forward to delve deeper into it because that's kind of got my interest now. It's very interesting to write such technical documents, and I have assisted the submissions of certain very important biologics, and I'm really happy when it comes through. And so let's see how it goes.
Amazing. That's quite an achievement. So, what are your top tips for medical writers to kind of do what you're doing and get into freelancing and working from anywhere?
So I would say, if I focus on this region, the Middle East, okay, there are a lot of expats which come and go. And I think the awareness of the medical writing community in general is very limited. So I would say that, we should focus on networking more, either via LinkedIn or in person, attending as many conferences as possible, and getting to know more writers in this region so we can form our own community as well. And, that would kind of give us some kind of foundation for, existing in this region of the world. I have worked with so many companies, in Qatar, Bahrain, Kuwait. And, when I tell them I'm a medical writer, they're like, oh, okay. So apart from this, what else can you do? And then I give them the list of things I can do. They are like, oh, okay, great. We did not know you can do this also. So I think it's just reach out. I know it's not easy to go and market yourself everywhere. I mean, it's not everybody's cup of tea. Honestly, it wasn't mine either. When I started off, I was not that, but then eventually, once you learn, once you get a hang of it, once you have some experiences to show, it gets easier. And retain your old clients because, well, they are like the base. So, until you get new ones, you know that something's coming in and it's going to keep you good going.
Amazing. I think one of the things that you mentioned earlier, which I would love to know the story about, is the language barrier. So you said you
Yes.
didn't really know English or Arabic. So how did you start learning English? And did you learn any Arabic?
Oh, well, I did learn basic conversational Arabic so that I could engage with the KOLs. And English, well, it's not that I did not know. I did know. I was pretty good at it. I've studied in a convent school and I've been, performing well throughout, but I was not a native speaker. So that became an issue for certain agencies to hire me. So that was like a, cultural barrier, you could say that, you are from India or you're from a country that does not have English as its, primary language. So would you be able to do it? It kind of, created a doubt. And so I think it was only when they saw my work, I could convince them that, yes, see, I can. It's not necessary that only native speakers can do it well. We can do it well too. So, and I think with time now that remote working and everything has been opened up with so much of digital things happening around, the world can finally see that, non-native speakers can also be good writers. So that is how and Arabic, yes, I think still it's a barrier for me, but I am learning. I am learning with my kids. I'm learning with, the people that I know. And as long as I can converse and say a few words, I think I'm good to go.
That's amazing because I think that can be a really big barrier, but also I
Yes,
think people have a bit of a prejudice as well. And I want to try and break down those barriers by having conversations with people like you to show that
yes,
you
yes.
need to think twice as well. And it's not fair to be rejected on that basis alone. So the fact
Well,
that
now
you,
it's not the case. That happened
yeah,
very like years ago when I started
yeah,
off when I was new. And thanks to COVID now, since everybody's gone virtual, it's like, okay, no problem. You don't know Arabic, it's okay, no issue. We'll do this. There are translators. There's so many apps that have come in. So I think it's become much easier to converse.
Yeah. Cool. So what's next on the horizon for you? What are you hoping to achieve
Uh,
as a medical writer in your career?
so as I'm looking to create a lot of patient education materials. I want to enhance the patient care in this region by reaching out to the public, and creating documents or, like any kind of that can be more appealing to the patients. Also, I'm looking to engage with more companies and, have more clients, create more high quality reports, and getting more into regulatory writing, hopefully. Let's see. So, if any organizations or medical communication agencies in the GCC region, you're looking for a medical writer who's open to experimenting and creating scientific documents, then you can reach out to me on LinkedIn. I
Amazing.
also aim to, my aim is also to create a good portfolio for myself. It's been long pending, and I think I'm going to do that soon.
Brilliant. I love that. So I also really like that you said, it's great to network and have a little community for
Yes,
people who represent the Middle East. So
yes,
I'm creating the International Medical Writing Association next year.
yes,
And so I'd love to kind of divide the sections by people's location. So
yes. I think
that
that's
needs
amazing.
to
In
grow.
fact, when I saw that you are creating an International Medical Writers Association, I was so impressed. I'm like, see, this is what we need. We need a global community. We don't need a particular country community. We need a global community. Maybe you divide it internally just, but then, it has to be one.
Exactly.
So I hope you do well, and I'm really looking forward to it.
Thank you so much. It's really nice to have your support. So I'll
Yes.
leave a link to your LinkedIn and anything else you'd like me to include in the description down below. And just to
Mhm.
say thank you so much again for this conversation.
Thank you so much, Virginia. Thank you. It's a pleasure to be online with you. I'm so sorry. Did I goof
No,
up?
you don't have to apologize. Thank you so much. And thank you everyone to
Thank you so
watching,
much.
listening. Yeah, thank you for watching and listening. And we'll catch you at the next episode. Bye. So what
Okay.
areas do you specialize in?
So the areas I've covered are oncology. I specialize in creating reports for breast cancer, lung cancer. I've worked for leukemia, HLH, rare disease. I've worked for cardiometabolic disorders, skin disorders, which are, predominantly very high in this region, atopic dermatitis, psoriasis. I've even worked for obesity, childhood obesity. I've worked for diabetes, women's issues, and mostly oncology. Mostly oncology. Yes.
Amazing. So what's your kind of opinion around AI and the use of AI in
So
medical writing?
call me old school. I'm not so very fascinated with AI, although I would love to explore what it could do in medical writing. But I think as far as it's limited to copy editing or proofreading, it's fine. Like you just have another something that's just checking, and then maybe you recheck the work that AI has done, whether it's actually making sense or not. But apart from that, creating content from the scratch using I am not very sure. I think it would be very mechanical, first of all, because human minds are different. We think creatively. We could bring something new to the table. AI would probably just bring what is fed to it. And, so we might get the same thing again and again. You see the same structure everywhere, and it becomes too mechanical. And I know scientific documents are technical, but it doesn't have to be, the same robo language everywhere. I mean, it's okay to have a little different language or some creative ideas. Human minds can get more innovative. So I know AI is here to stay, and eventually we all have to get used to it. But I hope it takes a lot of time, and human minds come up with more ideas and better solutions. And then people are like, let's chuck the AI and keep it very limited and use our head instead.
Yeah, I would say that that's a really good way to think about it. And I'm quite biased because I don't use AI apart from, proofreading or editing
Same.
or
I don't.
something.
I would just probably not for all my documents, but in case if I have something in a hurry and I know that, this has to be submitted, and I might just put it once through Grammarly or something. And yet I will never accept all the suggestions because I know it doesn't make sense. It changes the entire tone of what I've written. It's like it wants me to rewrite the whole document. It doesn't make sense.
Yeah, it's so true. And I agree. I think humans need to continue to try and innovate and be creative and
Yes,
we our language changes, year on year.
exactly.
We
You
change.
can you can bring your own spice to your document, and why not?
Yeah, I love that. All right. Well, it's been great speaking with you.
Same here. Thank you.